Hi, I am Katie. I am a registered veterinary technician. I teach the Veterinary Assistant program at the Academy of Pet Careers. And today I will show you a few things that we do in the veterinary clinic. Right now we are going to place a catheter in this dog. Well, appendage. All right, this is our catheter here. First, we're going to make sure that our catheter is good and usable. So we're going to take our cap off and we are going to flush it. Just some saline. Just put it on here and we just kind of squirt it. We're going to put our cap back on our needle here. Our catheter is doing good. And we have our nice little dummy dog. His name's Lou, just in case you wanted to know. And we're going to find his vein. His vein's just running right along here. We normally want to start our catheter a little bit low. We're going to go a little bit about right here today. Put my thumb along one side so I keep his vein from rolling away. I'm going to find the top of my needle here. And then I am going to just get our catheter right in here. All right, and what we're waiting to see is if we are actually inside the vein. Our dummy dog does not have very good blood flow, but there he goes. Now he's going in. He's got it. Got some nice blood flow. We want to make sure that we don't poke ourselves with our needle. We're going to stick that right back in our cap there. He's a little bit bleeding all over the place though, so I need to get a little cap on him. We're just going to do that there. I'm clean up my mess just a tiny bit. Oops, I made a mess. That's okay. Thankfully Lou doesn't feel anything. Now we are going to tape it in, so our little dog does not take it out of him. And I start with my sticky side up. And we just make a little tab there. And bring it around our doggo. There's our first one, and I want to make a little tab here so it makes it easier to take that tape off later. Now I got a second one, and I want it to go in the opposite direction that I just did. It just keeps it from going back and forth. And my dog doesn't have a body attached to him, so he's moving just a little bit. That's okay. Usually I'd have a restrainer. We got that all the way around here. And then one more piece of tape. Yeah, we really tape it in there. We don't want this thing coming out of him. We're gonna stick that right over there. That's just gonna secure all of our tape in there. One more nice little tab. Get that in there. Now I'm going to take this saline again, and I'm just going to make sure that we are in that vein. I just want to make sure, and yep, we're in that vein. I'll put my cap back on so I don't bleed everywhere. Poor baby. I have one more little better cap here. This is just so that we can put injections in him when we need to. And then we'll give him a nice little pretty vet wrap. Nice little pretty top to it. And he's all ready to go. He's got a catheter. As a veterinary assistant or a veterinary technician, you might be also assisting in anesthesia with surgery. So you might be working with a machine like this. You might be working with some of the tools that the surgeon might use. You might be handing them some of the tools. You might be giving them some of the tools as well, or cleaning them up. You might also be monitoring your patient as well. You might be taking a heart rate with your patient. You might be taking a respiratory rate with your patient. You might also be taking a pulse with your patient. And also, as a veterinary assistant or a veterinary technician, you might be looking at a lot of laboratory specimens underneath a microscope, and you might find things like parasite eggs, or you might be looking at blood samples, or you might look at things like ear samples where you might see things like yeast, like on this sample here today.